understanding your rib pain during pregnancy. So when you get pregnant, your body produces a lot of hormones that create the bones to move. When the bones move, that can create pain. Rib pain is not any different than pubic symphysis pain or other pain in your body. The deal is that your ribs have to expand in order to accommodate the growing uterus. So that's where the baby grows, and that's why your belly gets bigger. So as the fetus starts to grow, your ribs are going to expand. You probably noticed that your bra size or your bust size is actually increasing during pregnancy. And yeah, you might not like having to size up in bras, but you'd rather not have a ton of pressure on those ribs because the ribs can be really sensitive. Now, not everyone's gonna get rib pain, but when it happens, it is not comfortable. And so we want to do everything possible to help prevent that pain. Because when we're in pain and we're not sleeping or we're affected by discomforts, ain't nobody happy, right? So let me tell you how to get rid of your rib pain once and for all during your pregnancy. So let me give you 2 different ways that are really important to help train your diaphragm. Your diaphragm lives underneath your rib cage. Training your diaphragm is going to help reduce that rib pain. So here's a few things we're gonna do. We're gonna do lateral costal breathing, then we're gonna do diaphragmatic breathing. This is going to allow the ribs to move in different directions, giving them some lubrication. Because when you have rib pain, it's usually because the rib is connected right here at your sternum, and that separation is giving you some irritation either there or somewhere along the rib itself. There's a lot of nerves and blood vessels in those ribs, and so you can have rib pain really that wraps all the way around. Everyone's a little bit different on where it goes and comes from. So 2 forms of breathing. Here's lateral costal breathing. Lateral costal breathing, you can put your hands on your ribcage and take a nice deep breath into your hands. Inhale, think about widening your ribcage. Exhale and let it go. Inhale and open your ribcage. Imagine that if your diaphragm was an umbrella, you're trying to open that umbrella in like an upside down fashion. That's what your diaphragm is doing. Exhale and letting the air go. Now, the second way to do this is through diaphragmatic breathing. Again, you're going to use your diaphragm, but this time you're going to guide your diaphragm. Instead of going into your ribs, you're going to guide your diaphragm into your abdominal cavity, into your belly, allowing your belly to expand, allowing your pelvic floor to expand. So here's what that looks like. You're going to take a deep breath into your belly. Exhale and let it go. Inhale into your belly. Exhale and let it go. Those 2 forms of breathing are going to help train your diaphragm, supporting the rib cage. 2 bonus tips here that I can't not tell you about is if you have rib pain, get yourself some KT tape, some kinesio tape. That's that stretchy tape. Stick it on as far back as you can reach and just wrap it around towards your sternum and lay it flat. That is a really good way to support the ribs. I absolutely love that technique, and maybe I'll show that in a separate video at some point, but using that kind of tape can be absolutely epic in getting you nice and supported along that rib cage. My second tool that I love to use is take a lacrosse ball, stick it in your back, right behind where those ribs attach to the spine, stick it against a wall, and just rub against the wall, rubbing your lacrosse ball against that rib. That is going to feel really good in your mid back, and then that's going to take some of the pressure off of those ribs. So I hope you found this information helpful. I'm Dr. Allison Feldt. Like and subscribe here. If you want that kinesio tape video or the KT tape video of the rib, shoot me some comments. If I see some comments, I will get you a video. Personally, I will record that video for you. But I need to see it in the comments. If you want it, let me know and I will get it going for you. Please like and subscribe. Let me know what you want to see. I'll talk to you soon.